everyone, my name is Lindsay, and I'm here to talk about a wide variety of potential treatments for TMJ. They include self-management, physical therapy, medications, occlusal adjustments, intraoral appliances, and even surgery. It is strongly recommended to use the most conservative treatments possible. Conservative treatments do not invade the tissues of the face, jaw, or joint, or involve surgery. Because guess what? Aggressive treatments like surgery do not necessarily ensure improvement of the symptoms. So as science learns more about TMJ and its associated structures, many in the healthcare community are becoming more aware that TMJ disorders are far more complex and more common than previously believed. So in this video, we are going to go over some different treatment options. Some people with a relatively mild or periodic TMJ symptoms may try some easy options to try and improve on their own with some simple self-care practices. Self-care practices such as eating soft foods, applying ice or moist heat, avoiding extreme jaw movements such as wide yawning, loud singing, and gum chewing are helpful in easing symptoms, as well as being aware if you are clenching and grinding your teeth. So pursuing a soft diet is one way to help with your pain. Think about how much you talk during the day, chew your food, sing, yawn, etc. You're using that jaw joint an extreme number of times. So if you can minimize any of that time to give your jaw joint a little break, believe me, it's going to help. So always be sure, though, with any diet change, you are receiving all the vitamins and minerals needed to remain healthy. So another is physical therapy. Physical therapists can use multiple approaches to help manage TMJ disorders. Some elements of physical therapy, including exercise and manual therapy, have been shown to improve pain and functional outcomes for individuals with TMJ disorders. And let's not forget exercise. Exercise is a great first-line treatment in the physical therapy management of TMJ disorders. Several types of stretching and postural exercises may be very effective if done properly. Please refer to our other videos on our YouTube channel to see some great exercise and physical therapy options. So here are some other good things to remember. Resist the temptation to yawn by seeing someone yawning, as it will cause more pain. If you can avoid it, try to open your mouth as less as possible. Don't chew gum, as it tenses the muscles of your jaw. Don't bite your fingernails or chew a pencil. Find a way that is non-jaw related to get rid of your anxiety. Sleep either on your side or on your back. Sleeping on your stomach with your head positioned to one side can produce neck strain that can be transferred to your jaw. If you work a lot at a desk, take a break. Give yourself a few minutes to relax and meditate. Focus on your neck and face muscles, allowing them to grow slack and relax. Get 20 to 30 minutes of exercise 3 to 4 times a week. Exercise not only reduces stress, but also helps the body produce endorphins that act as natural painkillers. When you're under stress, don't clench or grind your teeth. You can put your tongue in between your teeth to make sure that you don't grind them. And then if you carry a heavy briefcase or purse often on one shoulder, try to lighten the load as the weight disturbs the alignment of your neck and spine. If you absolutely need to carry the load, shift it from one shoulder to another while you are walking. So now what are some of the treatment options? A splint may be recommended to treat your TMJ. A splint is a removable dental appliance that covers several or all of the upper or lower teeth. Constructed in a dental lab, splints are typically made of hard acrylic resin and molded from an impression of your teeth or an iTero scan of your mouth. You will be expected to wear it at the recommended times, whether it be all day, whether it be only at night, or whether it be all day and all night, as well as to come in for follow-up appointments to check on how your symptoms are progressing, or to have the splint readjusted if necessary. So what is the purpose of a splint to treat TMJ problems? Patients should be aware that there are different reasons for proposing the use of a splint. There are two broad categories. One is the splint is intended to provide relief from pain and improvement of jaw function so it can move smoothly. The second is the splint is intended to be a first step in a multi-step procedure. Wearing it will produce changes in the bite and in the jaw position. Men will require some form of major dental treatment, such as orthodontics, crowning teeth, etc., to establish a new permanent jaw position. The second approach should only be done with a provider that has the education and knowledge to do this, because if number two is done improperly, it poses serious risk because of its irreversibility. So let's talk about some of these types of splints. Splints are known by a wide variety of names, such as intraoral appliance, stabilization appliance, occlusal appliance, intraoral appliance, repositioning splint, bruxism splint, night guard, mouth guard, and others with names denoting commercial vendors promoting particular designs. So the first one is an upper bite splint. This splint fits on all of the upper teeth, thus it keeps the back teeth from touching and prevents both clenching and grinding. This one is generally worn at night. The NTI is a inhibition tension suppression system. The NTI appliance fits on the upper front teeth and is designed to help prevent the tooth from clenching and grinding. It prohibits a person from completely touching their teeth together, at least a small space, which in turn, of course, prevents from clenching and grinding. So the repositioning splint, this is a split most of the time on the lower teeth, is used to move the lower jaw either forward or backward, either to recapture a displaced or clicking disc or to establish a better jaw position. This repositioning can put the bite in the correct place, which takes the pressure off of the jaw joint, which allows the healing of the joint. Then, of course, you have your over-the-counter splints. These are occlusal splits that are sold in stores. They're made up of a type of plastic that softens when warm, and you can mold the splint to fit over your teeth. But with this, it is difficult to obtain an exact fit. It may not give you much of a benefit as what it would to get it from a professional. And then lastly, you have our sport mouth guard. Sport mouth guards are used by people engaged in contact sports to protect their teeth from injury. They're really not designed for use in patients with TMJ problems. So be aware, there can be harms that are associated with the wearing of these appliances. And that harm stems from someone at home giving themselves an improper fit or a provider fitting an appliance that is not educated in the proper jaw to cranial balance. If the bite is not in the proper place, more harm could actually come than good. So lastly, I just want to say a few helpful hints, things to do throughout your treatment, and that is some people have found it helpful to keep a diary of pain and other symptoms. A diary can help when you talk to your doctor. Keep a record of your symptoms and when you experience them and what may trigger them. Pay attention to what makes you feel better or what makes you feel worse. Keep a record of what time of the day you feel worse. And then if you have any x-rays or MRIs or other test results, bring them with you when you go see a specialist or to your appointment if possible. Your medical and dental records belong to you, and you can ask for copies of them. And lastly, if a medication is prescribed, make sure that you know about the side effects that you can get from that medication. So we hope this information that we've said today you find helpful, and as always, feel free to call our office with any other questions.